lot of people who have never been around diabetes are not familiar with the signs of diabetes. So all the signs were there prior to his diagnosis, but I wasn't familiar with them. So he had a little bit of weight loss. He was drinking a lot. He was peeing a lot. And he was 3 years old. So some of these were just normal toddler stages. So I didn't really see that there was a problem. And then he had what I thought to be like the flu. He was with his father all weekend, and when he came home to me, he just didn't look right. And so within 15 minutes, yes, your dad. Within 15 minutes, I went ahead and took him to urgent care, and they rushed him back, did just a couple tests, and then within 30 minutes, they said, your life is about to change forever. Your child has diabetes. Hard to explain. I mean, of course, you're just in shock. You know, I think I just went into survival mode, you know, because that's my child. So, you know, I was just in shock and was just trying to be there. And then you just have to learn. I mean, you really have to learn so much, and it's still never ending learning. So, I mean, that's a whole life change. You have to check blood, you have to give shots, insulin daily, numerous times a day, and you have a little person here that doesn't understand, and they're, you know, saying, please don't do that, please don't, you know, stick me, or, you know, but it's amazing how resilient they become, because, I mean, it's like night and day now. It's been 2 years, almost, or 2 years, and he does his blood checks by himself. He's so tough, so it's amazing. Even if I was to give him sweets, which he can have, he can eat anything as long as you're dosing the insulin accordingly to what he eats. So he can still have a normal life with food as long as he's having medicine to go along with it, not like the freedom of eating whatever you want and you just eat whatever you want. I think that his own little body naturally doesn't feel good if he has too much on its own. So he doesn't really eat that much sweets. And he eats a lot of fruits and vegetables. And so in that sense, it is good. He's actually, in a way, healthier than a lot of children because he doesn't indulge. But it's kind of a little tough, too, because he's, you know, a little person doesn't understand. Like, why can't I, you know, have something whenever I want, or, you know, so. But yes, I think he eats healthier than most children. His favorite thing, what's your favorite thing to eat?
Tomatoes and popcorn and ice cream.
But tomatoes is your very favorite. So you like tomatoes better than candy, practically. Huh. I do like to make sure he's always aware, and I want him to be very involved as well. And I want him to embrace it, to be able to help others, and to kind of give back. Because, like, when we were new, it's scary, and you need advice from other people, and I want him to be able to do the same. If there's a little 3-year-old, and he can tell them it's going to be okay, you know, when it's his turn to give back. So, yeah, we do the JDRF walk every year, and we try to educate all our friends and family. And again, mostly just to know the signs, because that can save lives too. Yeah.
And people donate.
Donate for your walk for JDRF, which is a great charity to help find a cure. Yeah.
So I don't have, so it's just, so a cure is like it just makes diabetes go away.
That'd be nice, huh? Maybe.